Well, doctors are seeing more women turn to weight loss drugs ahead of pregnancy. Studies show that being overweight can increase the chances of pregnancy complications, including miscarriages. And while the FDA does not authorize the use of weight loss medications during pregnancy, there is limited information on their effects prior to conception. So for more insight, I want to bring in Dr. Ilana Ramer Bass. She's joining us now. She's an assistant professor of the Division of Endocrinology, Diabetes, and Metabolism at Mount Sinai, and she leads the Mount Sinai Morningside Weight Loss Program. Thank you so much for joining us. I got to tell you, when I first heard this, it made me a little uneasy, but I don't know how far ahead people are, doing this, whether it's like a year ahead, but also I think, but if you just sort of stop it cold turkey because you found out, great news, you're pregnant, what happens to your physiology? What risks are, okay, we'll start with this. What risks are associated with being overweight during pregnancy?
Hey, thanks for having me. So obesity and being overweight are definitely risk factors for multiple adverse outcomes in pregnancy. So early losses, also things like increased risk of preeclampsia, gestational diabetes in the mom, sleep apnea, cardiac dysfunction, and then being obese during pregnancy definitely increases the risk of preterm birth, which has obviously a lot of implications for the baby. So we do try to have people enter pregnancy at a healthier weight, and having these medications gives us a tool to allow women to lose weight prior to conceiving.
All right, so then the follow-up question, of course, is, as Anne-Marie was pointing out, what do we know about the impact of weight loss drugs and the use of those drugs before pregnancy? Because when my wife was pregnant, I couldn't get her to take melatonin or Tylenol because she's like, I'm not taking anything. I'm just going to suffer through it.
And I also think of sometimes people get off these medications and they gain weight back again.
That's right.
And you're already gaining weight when you're pregnant. I don't know. There's a lot of questions.
Yeah, so we definitely do not authorize the use of these medications during pregnancy. So there are no studies and no data to support the use of these medications during pregnancy. We certainly stop them if a woman is trying to conceive in the next 2 to 3 months, or if a woman has accidentally conceived on the medication, we absolutely stop. So there's really no data to use the medication during pregnancy. However, before pregnancy, if you know a woman is trying to conceive, let's say in the next year or so, you can use the medication, stop about 2 to 3 months prior to trying to conceive, and have what we call a washout period, where the medication will be out of that woman's system by the time they conceive and have a pregnancy. So we definitely support the use prior to trying to conceive. You do have to counsel people to try to not get pregnant while they're on the medication, to be on some form of birth control, because we cannot use these medications during pregnancy.
Right. So it should be sort of a well planned out thing so that it's out of your system, but also, I presume, so that you're not setting yourself up if you don't have access to it while you're pregnant and you haven't actually acquired the skills to eat healthy, move your body, all that sort of stuff that will help to keep you at a healthy weight during pregnancy.
Yeah, for sure. And the thought is that if you lose weight prior to pregnancy, then going into that pregnancy, of course, try to stick with diet, exercise throughout the pregnancy for healthy weight gain during pregnancy.
There was one last question that we were going to get to. Maybe just a quick point, Doctor, about there was an ad campaign released in anticipation of the Oscars by Eli Lilly, urging people, I guess aimed at celebrities, but anybody who uses these weight loss drugs. Mounjaro is the one that they do, right? But I think encompassing all of them, Wegovy and what's the other one?
Ozempic. But I think some of them are for diabetes, but some of them are for weight loss.
Okay, so the ones that are primarily meant for diabetes, they put out an ad saying, look, you using these drugs so that you can fit into a dress that you can wear on the red carpet, or a suit that you wear on the red carpet.
Or to a wedding.
Or to whatever you're doing in your personal life, is affecting people who actually need this drug to save their lives. What did you make of that campaign?
Yeah, so I definitely think these medications have a purpose for people with obesity, for people who are overweight with metabolic diseases. I don't think that these medications should be used for people of normal weight to lose a few pounds. I think there have been many back order issues with these medications, and supply chain has been an issue. So I think that these medications need to be used for the people who actually benefit from them. And there's clearly a benefit for people who have obesity or who have type 2 diabetes. And they should be used for those people. Also, the cost of these medications is very high. It's only approved by insurance for the indications for obesity, for type 2 diabetes, and therefore they're very expensive out of pocket. And that means that only people who can afford them are getting them and using them off label. So I do think it's very important that they're used appropriately.
Yeah. Dr. Ilana Ramer Bass, thank you so much for joining us. We appreciate it.
Thank you for having me.